Hi, my name's Shayana Ledbetter. I am an MSN entry to nursing student and doula in the Birth Companions program at Johns Hopkins School of Nursing.
Hi, I'm Dr. Noeline Jeffers. I'm an assistant professor and a certified nurse midwife here at the School of Nursing. I study Black maternal health, and I'm also a new mom.
A doula is a support person who provides emotional and physical and also educational support to a birthing person, and we can be there for them throughout the pregnancy as well as during labor and postpartum. We also typically will have a few visits or one visit just to check on how they are doing emotionally. They are not medical personnel, so they can provide that additional support outside of the medical and kind of have that outside view and provide any extra support that the birthing person may need.
What I think is interesting is that for many years, hundreds and hundreds of years ago, we always had friends, family members, sort of people who we loved care for us during pregnancy, birth, and postpartum. And so now it's sort of this new profession, but it sort of harkens back to a time when we sort of built in community into birth. And it's just great that we're getting back to it now.
I agree.
So what we know is that Black women and birthing people say that they don't feel heard, they don't feel respected, listened to, cared for. And we know that that has translated into poor outcomes, unfortunately. So Black women really face a disproportionate burden of challenging complications in pregnancy, birth, and postpartum, and also face higher rates of death when you compare them to their white counterparts. And so this is important because doulas sort of provide that anchor that's really necessary in pregnancy, birth, and postpartum. They provide the support that you're mentioning, whether it's providing information about coping with pain, whether it's providing that sort of hands-on support, the massage, whether it's providing information about choices in birth, and that sort of one-on-one attention is important. Community-based doulas in particular provide that racial and cultural identity and connection that also helps to sort of stem the impact of some of the more structural factors that are impacting our maternal health care system, like racism.
Yeah, it's very important. Yes, the disparities for Black women, especially in maternal health, has impacted my desire to go into labor and delivery. I do want to be someone that can represent Black women in this field. I feel like when we have people that look like us or come from similar backgrounds as us, we can trust them a bit more. And I think that the hospital can be a really scary place for people. A lot of times when they are pregnant, that might be the first time that they've ever been in the hospital, and they typically in childbearing age, you are the healthiest that you've ever been, and so it can be really scary to be in the hospital. So that has led me to want to represent these people in this setting, in this way.
Absolutely. I think I've had sort of a similar trajectory. I came to midwifery not because I knew about Black maternal health disparities. I came to it because I loved just what midwives represented, how they provided care, the respect, the compassion, spending time with patients. But when I went to midwifery school, I started learning about inequities in healthcare and decided, okay, well, this is what I want to really focus on in my career. And so my first midwife job was in Washington, D.C. at a federally qualified health center, and I was a community midwife. I lived in the same community as many of my patients, and at federally qualified health centers, we provided care to patients regardless of their ability to pay, and it was just really special to provide care in the same community as my patients. The focus of my work with doulas and the Black maternal healthcare experience is that I focus on how doulas and healthcare systems can partner in equitable ways to provide additional support and promote Black maternal health. So doulas are really rooted in sort of, community. They're rooted in radical ways of healing and in radical ways of support. And how can we draw on those roots of healing, support, companionship, and think about how they can improve the ways that our healthcare system is really fragmented and unfortunately needs to sort of step into.
So Birth Companions is a program here at Johns Hopkins. We provide community-based support for individuals in the Baltimore region, and we provide different levels of emotional, educational, physical support. And prior to going into the birth with the birthing person, we will create a birth plan and just what do you want your birth experience to look like? What's your ideal birth experience? Because there are a lot of factors that we can't control in labor and delivery, but there are things that we can and we can try to plan for. And so we just offer that extra level of support, answer any questions that we're able to find the answers to if we don't know them. And yeah, it's just really great having that additional advocate for them in the hospital setting. And my favorite thing about Birth Companions is that it's a free program. So Hopkins has made this very accessible for the community members of Baltimore.
That's wonderful because doulas for many people aren't free. There are many doulas who may charge $1,500, $2,000 or more for their services, which is very much well-deserved and important for them to be paid equitably. But it can be a barrier for those that are really needing that extra support. So I've had two really different birthing experiences. I gave birth the first time in May 2020, which was just about 5 or 6 weeks after the whole world closed down with COVID. And so I could only have one person with me. And I had really planned to have an unmedicated birth, and I had contracted with a doula and thought that I was going to get that hands-on support that doulas provide. And unfortunately, because of COVID, I couldn't have that in the way that I had envisioned. And so this time around, I just had a baby about 4 months ago. I was determined to get my doula. And so it was just so different than the first time around. I had someone that was just there for me, not just during the birth, in a lot of ways, even just having them for the pregnancy, and having their ability to sort of call me in to my pregnancy was just so impactful. I was trying to get all my work done and my research squared away at the end of my pregnancy, and they really called me to remember, hey, you're about to bring a new life into this world. So in addition to sort of that physical support, just sort of emotionally helping me be in tune with sort of the pregnancy and the birth that was going to happen really soon. And then during the birth itself, just simple things as asking what I needed, rubbing my feet, providing me with different ways to use birth balls. All of that was really important.
That's great. When I began Birth Companions, I wasn't really sure what that would entail, what that experience would be until I was in the delivery room and I witnessed the first baby being born. And I don't consider myself an emotional person, but it was just so beautiful, the miracle of life, and the relationship that I had built with this mother was very special, and we all were enjoying that moment together. And I just started crying and I couldn't help myself. I was supposed to be the camera person taking pictures, and I was like, I got the pictures, but I can't see if they turned out good. And it was just a very beautiful experience. And this was an important birth for her because her first pregnancy, during the labor, she underwent a labor procedure that she had not consented to and she did not know about until after the fact. And she said that that was a very traumatic experience for her. And so this time she, reached out to the Birth Companions program, asked for that additional support, and we were there to advocate and make sure that her birth experience was as close to her birth plan as possible. And it was an uncomplicated labor. It was a very beautiful moment. And something that we don't think about is how pregnancy is something that can be traumatic, and we can bring that trauma with us through the rest of our life. And so, I was just very happy that I was able to rewrite her birthing experience and help with that.
I love that you were providing sort of that advocacy support. Last year during Black Maternal Health Week, I led a convening. We call it a Black Maternal Health Week Cafe, and it was really focused on partnerships between doulas and healthcare systems. And something that the doulas mentioned was the ways in which they can sometimes be a little uncomfortable with physicians, even midwives and nurses, because sometimes there's that, negative relationships. And so providing advocacy can be sort of this tricky situation. How do you handle that?
I'm in a unique situation because I am a nursing student, so I do empathize with the nursing and the interprofessional team because I know that they're working hard, and they're just trying to keep the mother and baby healthy at the end of the day. But I think that being a doula, on the other side of things, I understand how important it is to center the mother in all aspects of this process. This is her birth, this is her experience that she'll take forever. So I kind of just prioritize the mother at all times. I keep it respectful, but I remember why I'm here and what my goal is here.
That's awesome. And I think that we should be working towards seeing doulas as these essential members of the birth team. And in that way, then everyone sort of wins, and we are able to prioritize and center the needs of the woman and the birthing person. What I want people to take away from this video is that doulas are just one part of the solution for Black maternal health. I think doulas are really skilled in building trust, in providing advocacy and emotional support, in providing especially that cultural and racial congruency oftentimes. But we also need other solutions as well, thinking about how hospitals, health centers, private practices, clinicians, healthcare providers, and some of the larger structures can also be improved, providing support in housing, food, employment, all of those structural and social determinants of health that we also know play a large role in inequities in Black maternal health.
I agree with that. Birth Companions is a free doula service that is offered in the greater Baltimore area. Links to more information will be below this video. And for any prospective students or students at Hopkins who have the ability to enroll in Birth Companions, I highly recommend it. I would have never known that this was an interest of mine until I took the leap and did it. And anyone can be a doula.